Hi, my name is Mary Wade, and I'm going to talk about the Indian Health Services RPMS. Introduction. The Indian Health Services are looking to use the electronic health record product, which is to focus on Native American tribes who are in need of assistance of medical care and proper healthcare delivery system. The purpose of the EHR product is to implement a federal fund health system for the Native Americans and to focus on the patients, Indian healthcare clinics and facilities, and relationships between the medical care staff and the consumers. The EHR functions for the Indian Health Services is to use the information technology to improve the quality of care by utilizing and regarding to unserved settings. Our overview and goals are to assist the tribal communities in healthcare research. We want to provide the healthcare and health data by monitoring healthcare disease risk factors. We want to conduct healthcare programs. So our main goal is assisting the tribal communities to promote and provide healthier lifestyles for Native Americans through federal and state program funds partnered with Indian health clinics in the communities through grants and medical assistance. We want to view the health status of Native Americans and identify and implement the problem areas, lower the health risks, lower chronic disease management among the Native Americans, and reduce the medical errors. My reason for choosing Indian Health Services for my EHR topic, for one, it's a personal level for me. I am Native American. I've been working at the hospital for the past 7 years, and I have seen Native American patients who have come in severely ill and life-threatening diseases, and they were not given the proper care when they first went to the Indian Healthcare Clinic. So I'm hoping to change that for the better. I would like to work in the future for IHS as a healthcare administrator, and I just want to learn a little bit better base foundation and understanding of the EHR product for Indian Health Services. The rewards and risks for using the EHR product in the Indian Health Services is that it is designed specifically for the tribes, for the urban and healthcare facilities. Provides a variety of information, helpful links, and documentation, so it reduces the paper documentation. It's where the staff is able to ask their patients anywhere from their education, health history, to immunizations that they can document and have on file. It provides a coding support, a referral tracking, and you can put in proper medical order entries. Also, it increases the delivery health system for more remote tribal locations, increases the providing care of severe medical resources, and it breaks the barriers between communication. There's more storage support for medical records and data results, and it is user-based friendly. The cons for using the EHR is not just the software, the hardware, the network requirements for each facility, but it is the funding, it is the training the staff to convert over to a new system, and getting the patients to understand why we're converting to a new system and have their cooperation as well. Our stakeholders are the Indian Health Boards, the Metasphere System Corporation, the Health Information System Society, Indian Health Services, and the Department of Health and Human Services. Among these stakeholders are also the patients, the tribal members, the physicians, and the medical staff. The finance considerations that we have to look at are the budget expense of how much to reduce on patient care costs, the pharmaceuticals, the medicine healthcare programs for each community, the grants, the recipient awards, the incentives that are earned and provided to IHS communities and healthcare facilities. We have to look at of how much is going to be spent on medical procedures, how much to spend on the EHR software. What are the reimbursements of insurance companies? Do we use commercial off-the-shelf adoption? Do we decrease the administrative costs? Do we extend the loan programs? We need to look at the budgets when it comes to our healthcare programs of substance abuse, illness and injury, nutrition. These are all just different finance considerations to look at with the National Indian Health Board. So our timeline is we're looking to survey over 200 Indian healthcare facilities over a 2-year span who use the EHR product, look at any performance issue, and facilitate a better documentation of care and healthcare outcomes. Our main improvement is the primary care. Our target is to implement patient quality care by using medical information technology to our advantage. So we have a graph here of just looking at patient care, the community care, documentation, and IHS services. And over the 2-year span, we want to see it increase and improve in each area. We are hoping by the year 2016 that all federally recognized tribes and Indian clinics use the EHR product. Our rankings. After we reviewed the 2-year EHR survey, we saw that using the EHR product in IHS, 60% felt that they had a positive improvement in the process. 30% saw an improvement of their quality care. The other 30% felt a decrease in patient-doctor interaction. There is an 80% improvement in technology information use, using the tools of telemedicine programs, the EHR product, and information resources that were available to them on quality of care. These results just showed a better utilization of documentation and third-party reimbursement. So we saw an overall improvement in customer service, satisfaction rankings, and an improvement on using technology information resources. We still need to work on patient-doctor interaction and medical documentation. Specialty services. What are the specialty services that are offered when you use the EHR product? There is health research, there's surveillance, training programs, online classes, there's resource and patient management system that's available not just to the staff but for patients to look at as well. There is health information anywhere from epidemiology topics of the flu and outbreak that has happened in the community to substance abuse to diet and nutrition, diabetes programs, anything about cancer, dental. There's a huge variety for these patients to look at and for the medical staff to look at too and give any information to the patients. It offers a flexibility for staff members to move their core objectives that they want of their menu setting and patient files. So our conclusion is to improve the quality of life and care for the Native American tribes and the IHS system through the delivery of technology information based upon the programs, the resources identified, and funds that can be given or provided to help identify any healthcare problems and utilize what is given to us to treat each patient to their every need and want by decreasing the healthcare risks among the Native American tribes and increase a positive outlook on life and quality of care.